Community CAMHS is a huge place to work, and it has a lot of different structures, different parts to it. So as part of anyone's induction in community CAMHS, you kind of buddied up with someone. You'll have a line manager on top of that buddy. You'll have a clinical supervisor who will match that professional background. And we don't just say, oh, there's your supervisor. We kind of like try and find the right fit.
We get regular supervision. I have supervision once every 2 weeks. So she can help guide me into certain things or provide resources and help me go through certain interventions. And if there's any tricky situations, the supervisor's always there to help with as well.
I was attracted to working here because I wanted to support young people and families. I wanted to provide a structured and collaborative approach to understanding their mental health difficulties and to be able to offer them the right support through signposting to relevant services in the community.
So what attracted me to work within CAMHS is working with the community, helping members of the community, especially sort of with their mental health, because they work with a lot of different community groups, such as colleges, schools and youth groups as well. I really like that idea, working with different presentations.
I've worked in children's services for 15, 16 years, and in the course of that became really interested in systemic practice and wanted to pursue that, and CAMHS offered me the opportunity to pursue a learning and development opportunity to do that. I think we're very conscious of how people that come into the service and might need to use the service, how they might be feeling, what might be going on for them.
The other access and support that I've received was through my high school at the time, and compared to CAMHS it wasn't as personal and catered to me. It was whatever fit around my school timetable rather than what fit around my lifestyle. When I got into the service, I was offered different forms of therapies almost straight away. So I got allocated a caseworker, and if anything goes wrong, I know I can just ring up CAMHS and they'll book an appointment in almost straight away.
A day working in this team is very varied. So I may be working with young people, delivering one-to-one interventions, group work or classroom consultations. I'm also involved with liaising with school mental health leads, parents and carers, and delivering school consultations. I could be liaising with external agencies around Bolton, and on some days I may be delivering supervision.
Bolton Lads and Girls Club is a charity. They support young people and families, so they have a young carers group, they have youth sessions in the evenings, have a wellbeing offer, and they work in partnership with Bolton CAMHS. It increases accessibility for patients and families. There's also shared learning opportunities between both teams.
The challenges of working for CAMHS, it's making sure you do the right thing, making sure that the young people feel supported and that you don't miss anything and that you do a good job and that you make sure you listen and the children feel supported.
In GMMH and in community CAMHS where I work, we do a lot of research. So there is a specialist research centre as part of the organisation, looking at new treatments for depression and looking at new treatments for autism. So it can be quite exciting.
There's lots of opportunity for people to progress. There's a lot of diversity in the staff. There's lots of social workers, nurses, we've got an OT, we've got a range of different modalities from psychotherapy, DBT, CBT, family therapy. So there is just so much to learn, and people with different skill sets, different expertise.
I live in Wigan, it's a great community, everybody is really supportive of each other and help out when needed. And I'm close by to my own children as well, which makes me feel more comfortable. The staff facilities here at Wigan are great. Everything's been done up. We have the facilities to make meals together and we all sit around a table and eat together. It's really nice.
So it's really exciting to work in Bolton because recently, due to our participation and engagement work, we've formed some really close links with Bolton Wanderers. We've actually done some kind of wellbeing work at one of the football matches.
We also have access in schools to nice spaces such as a wellbeing room, and if we need it we have access to the appropriate staff in terms of safeguarding and risk.
If someone wanted to apply for CAMHS, I'd tell them to do it. It's really rewarding, it's really beneficial, and you get to see a change in the children's lives. You also get to work with parents and carers and work closely with other members of staff and other services. But overall, you get to see a change, and that's the whole reason for the job. And if you're really passionate about helping young people and wanting to see them happier and change and help their mental health, then CAMHS is the right place.